Dhwani, second year BPT student. Today I will explain about opioid addiction in psychiatry. So, opioids are drugs that bind to opioid receptors in the brain, spinal cord and other parts of the body. They reduces pain, produce relaxation or euphoria, slows the breathing, cause sedation. They are commonly prescribed after surgery, injury, cancer pain or severe chronic pain. However, prolonged or improper use can cause dependence and addiction. Opioid abuse. So it means taking opioids without prescription, taking larger doses than prescribed, taking them more often than prescribed, using them for pleasure, euphoria instead of medical reasons, using someone else's opioid medication. Over time, this can develop into opioid use disorder, a chronic medical condition involving compulsive opioid use despite harm. Causes and risk factors. Biological factors, family history of addiction, genetic vulnerability, changes in brain reward pathways. Psychological factors, anxiety, depression, trauma or stress. Social factors, peer pressure, easy access to drugs, poor social support. Opioid addiction. So there are 4 stages of opioid addiction. Stage 1 is the initial use. Person uses opioids for pain relief or recreation. Stage 2, tolerance. The body becomes less responsive, so higher doses are needed. Stage 3, dependence. The body adapts to the drug and stopping causes withdrawal symptoms. Stage 4, addiction. Loss of control, compulsive use, continued use despite damage. Typical withdrawal symptoms: cold shakes, chills and sweating, fever-like symptoms, mood swings, anxiety and depression, bone pain, vomiting, insomnia and diarrhea. So, management of opioid abuse, assessment and diagnosis. First, healthcare professionals assess type of opioid used, duration and amount of use, physical dependence, withdrawal symptoms, mental health conditions, social and family support. Withdrawal management. Detoxification means safely stopping opioids while managing withdrawal symptoms. Common withdrawal symptoms are anxiety, sweating, body pain, nausea, vomiting. Medicines used during detox. Clonidine, which reduces sweating, anxiety and agitation. Loperamide helps in diarrhea. Ondansetron helps in nausea or vomiting. Detox alone is usually not enough. Long-term treatment is needed. Medication-assisted treatment. Methadone is a long-acting opioid medicine, reduces withdrawal symptoms and cravings, taken under medical supervision. Buprenorphine, partial opioid agonist, it reduces cravings, lower overdose risk compared with full opioids. Psychological treatment. Behavioral therapies are very important. Cognitive behavioral therapy helps the patient to identify triggers, change unhealthy thoughts, develop coping strategies. Motivational therapy increases willingness to quit. Group therapy, peer support, shared recovery experiences. Thank you.